Hello, everyone, and welcome to another panel discussion with Gravitas AI. Today, on our panel, we have Mr. Girish and, of course, our very own Aarsh, who's the founder of Gravitas AI. Let's first understand what is the topic for today's panel discussion. It's operations management made easy with infusion of AI. And to give us more information and light on this particular topic, with us we have Girish here, and he is the Director Operations and Growth for Southeast Asia, South Asia, and other regions with Access Health International. So, welcome aboard, and thank you so much for being a part of our panel today.
Thank you, Sneha. Thank you, for inviting me for this panel discussion. Amazing, and love to discuss and contribute to this area.
Thank you. And of course, like I introduced earlier, we have our Srivastava with us. He is a co-founder Gravitas AI. Welcome to the discussion.
Thank you, Sneha. I'm really looking forward to a very interesting discussion with Mr. Girish and yourself.
Great. With that energy, let's dive into our opening question. And I would want to pass this baton to Girish. So, if you could give us, say, a broad idea on what are the challenges and also opportunities that we can probably think about when it comes to integrating AI into operations management in healthcare. So, in your experience, if you could just list a couple of challenges and opportunities that come along with it.
Right. Yeah. I think when we looked at AI, it's been now a couple of years. While there's a progression of usage of AI and much more acceptance today than in the past. But primarily the challenges when we looked at in healthcare, typically if you look at even if you look at a provider sort of thing, a hospital today, you would typically they will use a lot more on transactional billing, and the ecosystem is to connect dots with the right data. So how do you have the right data ecosystem is one very important. How the data really gets integrated into the healthcare. So whether we talk of a hospital or an insurance, or we talk about a public health, how the data is formulated, collected, and what sort of data points we are looking at. So if you look at a patient and patient journey, right from a village to a hospitals and coming back, so on, do we have the entire journey data, how well it is captured? So one is the data points, access to it, whether it is there or not. I think that is the most important thing, and we see that there's a challenge at that when we actually go ahead. So they are missing data points. Second is the quality of data. So are we entering the right data? uh, and how you are assuring the data is good. So when we have the quality assurance in terms of data quality, what we speak, we need to look at how good is the data what we are getting, because if we are building solutions based on the data sets or modeling, we need to have the quality of data is very important. And they've been programs or pilots where been happening. Means there's one example where we looked at in India. There's an organization called Art Park working with AIMS and other agencies on a project mode and a pilot to see and standardize in terms of getting quality of data from healthcare institutions. So I would say is that data and quality of data is one, the availability. The other thing is the integration. So what you see is that if you have old legacy systems, systems which are not present, how, and if the data is in silos, so how do you integrate with the existing systems? All may not be feasible. So how do we go about doing that? The other thing is that obviously the challenge which all the governments and across globally is what being addressed around data security and privacy. Now, how do we go about doing that? And there's been a recent law which been passed in India. There's a recent AI regulation which has been passed in Europe. So I think the data security and privacy needs to be addressed. We know that a patient or the member has access to his data, but how good is the anonymous, how well it is articulated and exchanged. For example, in India, we have the global now with the National Health Authority and the Ayushman Bharat digital mission happening today, which gives you a provision of consent, and post consent only it gets accessed by different providers. It could be a doctor, a physician, pharmacy, or a hospital. How well it is taken care. So I think it is, I would say, not a challenge, but it is both sides, a challenge and opportunity. How do address, because then we have millions of people who could be covered and accessed in a right way, and solve this important problem of not carrying the bags. You have tons of bags to carry from one hospital to other hospital, and there's no seamless connectivity of what the data is being looked at by each doctor, physician, nurse, or lab, and critical points are normally missed out. So I would say is that while privacy and sharing is important, and that's a concern, but I think that's been getting addressed through regulations and policy and laws. But the other side is also is that how do you really the opportunities reduce this burden
Hmm.
in terms of opportunity? As I said, is that how do you really make this access using technology? uh, Opportunities, I would say, is that means it's been working largely in various areas. The opportunities what we have today, one largely you look at efficiencies and cost reduction. So your routine task of administrations, normally admin becomes the first point, and easy opportunity to reduce your efficient system, scheduling appointments, reminders, notifications, so on. But also is to look at resource allocations of whether it's manpower, your inventory, your supply chain management, how you can look at that effectively is an other area we can actually look at in terms of opportunity.
Right.
And analytics in terms of if the data modeling is done, I think you can largely look at disease management and prediction. So when you look at a large public health, let's say a couple of states or at a country level, can you predict based on your existing data on risk classification, triage them and understand the uh, entire cost versus clinical, who are at risk versus who are not, what sort of a modeling you have, and how do you really reach out. So you can actually design your healthcare system much more effectively by using your systems and also using predictively. So from an opportunity, I would say both at cost reductions, efficiency, clinical management, and you would also see is that AI is also getting used. So one of our projects was also looked at uh, anthropometric, the neonatals measurement. Can you do it much more better than a health worker? So there's a way we can do it and help solve a larger public health challenge. And I would also say a couple of works happening in controlling media, or how the outbreaks, the news is more authentic rather than false alarms and other things. Even that could be controlled by using this. So I wouldn't say the dimensions are huge. The only thing is that the use cases are going up, and the acceptance would come in as we adopt this space.
Yeah, quite
Right.
elaborate, quite elaborate. Like and very. He's covered like the whole spectrum, but I can add a few pointers here and there. When the acceptability is the point which Mr. Girish left at the last, and that is something which is a challenge because we can accept at certain levels where there's understanding or a bit of like people are aware of AI, but there are various other stakeholders in the whole ecosystem which are probably not aware about AI, its uses, and they have certain threats as well in their minds. So that needs to be removed. So these are the challenges from a user perspective. The stakeholders which are there in the whole ecosystem, they need to be like more aware about like artificial intelligence, its usage, not at the level where like people understand it, but also at the different other levels where people will be using it in different operational aspects. So that is like a big challenge, but yeah, definitely there are a lot of opportunities to silo to integrate the siloed operations, to find the blockages in between different departments, operations, and try to plug it with AI solutions. Not necessarily always AI solutions will be the plug, but mostly with a lot of like efforts which can be done through artificial intelligence and the machine learning algorithms, that can be a very game changer, along with the applications which can come into use and can be very handy in terms of integrating these AI solutions together and stitching it together. So definitely a lot of challenges and are there still because healthcare has been unstructured, a bit unstructured, but with the regulations coming in, there's definitely an effort which is there to knit it properly, and that also opens the gates of opportunities which are humongous.
Right. I think we've taken a fair view at what opportunities uh, are available, and with every opportunity, of course, comes the challenges. So, how can we tackle those challenges as well? May it be with the clinical aspect, or may it be with the operational aspect. Trying to dive into a bit more into the operational aspects of it. So, how do you think that AI can actually transform traditional processes like, say, scheduling appointment, which we already discussed, or having an admin in place, or say, giving post-op support, which is again very very essential because a lot of surgeries, say in case of cardiology or ophthalmology, there's a lot of post-op support that is required, which then justifies how successful your surgery was, right? So, how can we manage all these things using AI? And of course, there are tools available. There are different kind of solutions available. But in your view, Giri, so how do you feel this falls right in the space of AI and healthcare?
Yes, I would say is that the traditional processes, both I would address both clinical and non-clinical. See, at a non-clinical level, is that means we had bots, we have AI chatbots, virtual assistants. Your simple processes could be straight away done. So even like a call center calling, which is there, uh, if you're integrating your data points and you automate to a process flow, okay, the ability to integrate it is what we need to look at. So traditionally it's like it is siloed, you come, you take an appointment, then you schedule. I think it could be done more seamlessly, it could be done from home. And more importantly is that the UI of making this happen is more important. Means one is the technology side, so the adoption side is the ease of use, or the user interface is good enough for people to accept. So it should be at a click, it should not take huge time, so on and so forth, and it can be done from home also. And with the payment systems which are there, with the fintech happening, growing in leaps and bounds across places, it could be done in short period of time. It is happening in other places. So in healthcare, when we look at in this routine operations is one. Similarly, you can look at your insurance claims, reimbursement processes, coding processes, even your medical record system can be done beautifully. Today, you have all manual medical record systems. Can we really scan and make it effectively? And going forward, you have a barcode scanner, so on and so forth. The data is picked up much faster. That is one.
Correct.
Then how you integrate your medical record systems, your insurance systems to your billing system. It could be automated. So your entire claims and reimbursement could be much more faster and better. Yeah, means they've been obviously technologies on robotic process automation, and then using AI tools today. The idea is that cluttered data, your contracts, your systems with different payers could be easily minimized, can be done with almost very less error rate, and it reduces. One is obviously your cost side from the manpower, but also increases your efficiency, especially if you're looking at a 400 bed hospital, 500 bedded hospital, large institutions. This is very, very effective. So you can use in insurance, you can use in claims, you can use in any other aspects of even in customer experience today. Could also be used. Today, the customer engagement itself is also siloed. While you look within the hospitals, but how do you connect outside the hospital? How personalized it is, how well it is taken care, could also be another area for my customer engagement and analytics point of view. Could be looked
Correct, correct. I think
at.
patient engagement is not only a part of the internal communication, but excessively a part of the external
Yes.
communication that's happening from the hospital. So you've mentioned that very, rightly. Arsh, any take on this?
Yeah, definitely. Like as yeah, is mentioned that we need to have a holistic solution which can be a 360-degree kind of solution which can connect with different kind of operations which are there. And we are working in the similar direction as you aware, Sneha. So Gravitas AI, we are into customer 360, healthcare 360, education 360. That is the approach we are taking, and we are trying to automate the interactions with the patients, wherein the patients have omni-channel engagement with AI assistants across all the digital platforms where they can possibly interact. so that there's minimal effort there for the receptionists to keep answering the calls. And also for the patients it's useful because then they can easily get the answers, they can book the appointments, they can do the payment. So the bots we have developed are into the space wherein the bots can provide information, they can provide notifications, reminders, book appointments, generate leads, do the payment gateways. So basically we have integrated payment gateways, so bot can take payments, give the notification reminders regarding that. And then we have got on the other side the platform which is integrated with the bot, wherein the bot is generating the leads and the platform is consuming that. Bots booking appointment, the platform is consuming that. We've got active configurations in the platform wherein the doctors can even say to the platform that okay, I'm not available this day, and the bot will automatically understand from the platform itself that okay, I have to change the whole appointment schedule based on the availability of the doctors. So that is where we have produced the intelligence of AI into the platform ecosystem as well, and automating the processes further, doing the EMR system, medical record system, and then integrating with finance, and then coming with a BI solution which is there to implement and show the insights not only coming from the different processes inside the application but also from the chatbots itself, because chatbot data is actually real user research data, because it's very difficult to collect all the information on emails, phones, but whatever chatbots are collecting data, that data is getting stored somewhere and we can actually draw a lot of insights from that. And then the next step is probably going towards prediction and classification and clustering, so that we can actually start looking into more sustainable ways of doing operations.
Right, right. I think with that, we can move towards understanding, of course, with an example, Girish, if you would have that handy. We'd like to understand that, we've understood, okay, data is helping us give us a predictive analysis of, say, it could be on the clinical front or it could be on a non-clinical front. But specifically speaking about non-clinical front right now, can we look at, say, predictive maintenance, or can we look at, say, demand forecasting by utilizing these data assets that we would have?
Yeah, yeah, sure. I mean to say, I mean, there've been examples where most of the medical equipment, which is in critical care, they've been cath labs, where you know the scheduled maintenance, the downtime, how much repairs, how do you go about doing that, keeps reduction in your downtime, real time data to help you to ensure the maintenance of the machines are taken especially carefully well, especially in critical care areas and high end equipment. It reduces your cost of maintenance overall. So we can apply to maintenance systems as well. We can look at inventory management or supply chain management largely. If you also look at is that we need to know is that the inventory today is based on a distribution channel from different vendors vis-a-vis to the stock to the number of days you need to manage. Now it's all about data flowing from the vendors to your inventory systems today. Now it's in a typical HI system. You have inventory management model, which is more dashboarding, but you have to really look at is at what times it actually receives your typically if you plot your trend of data, which vendors actually sends you at what time, when do you receive, and when it's actually in the system for accessing these people. So you can
Correct.
actually connect the dots, and then you can have the ordering accordingly. So
Hmm.
today that moving away from a static system to a more dynamic system is
Hmm.
what AI can actually predict. One second is that based on the utilization patterns within the organization, especially healthcare organization or even a public system, you can predict what could be out of stock versus what is being utilized. A trend patterns analysis and forecasting can easily be done using AI tools, much more predictive. In fact, you can have much more business case around how do you use your capital well in terms of ordering and managing your inventory and save cost in terms of capital and storage.
Hmm. Right. Arsh, so in our experience, of course, we work with so many different healthcare establishments. So any specific, experience that you would want to add in terms of, say, demand forecasting, or specifically that can help the healthcare institutes leverage the data for, say, supply chain or purchase?
So there are different types of use cases, and it will depend on the type of entity we are talking about. Sometimes like the usefulness is dependent upon the department and the type of company as well. For example, and reorder points are definitely something which is very important. Case in point, from a demand forecasting perspective, wherein we can actually try to understand what is the seasonality component, what is the component regarding any other variables which are in there, so that we can start predicting on the basis of the previous data that how your demand will be there for the next few years, in coming few years. So that has a direct impact on how you manage your cost, the budget, and also the amount of human resource or infrastructure resource which is required to maintain that. So
Right.
in that space, definitely there's a very good use case, but it will depend on a type of department or a type of industry or a type of even within the industry sub verticals.
Hmm.
Will vary case to case.
Correct. 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 That's given us a fair bit of understanding that where all we can place different infusions in terms of AI solutions at various touch points in our operations process as well. Moving to our last and final question, which is again very very essential for our viewers to understand that everybody has a concept of AI in their mind, right? That AI is going to say either replace a human somewhere, or is it going to add value, or is it going to only kind of be a solution or a technology that it will be very difficult for healthcare to absorb into, right? So there are various misconceptions that are there around healthcare and AI. So of course, the first one that first myth that we would want Girish to speak about is that will AI replace healthcare professionals? Clinically, of course, no, we're aware of that. But then, what will happen when it comes to these non clinical roles? And in case you have any other myths that you have come across that you would like to speak about, we'd love to hear you.
Yeah. So, I will say is that even before AI, there have been obviously tools, technology have been increasing efficiency and cost reductions even before AI. AI is an addition to make it much more better and effective. So, in that context, it is not about replacement. I would say is that the way you organize the work, it gets defined and better, and you will have maybe repurposing of the roles basically, and the jobs accordingly. For example, if the bots are working in
Hmm.
sharing of data rather than humans, right? But at the end, there needs to be a decision and action. So the amount of data could be handled is larger and much better. So what we largely would see is that while efficiency and cost would reduce, it may not necessarily mean a replacement. It is basically a repurposing. A new definitions may come in terms of roles what we operate. Maybe you may find people working specifically with AI roles working right within the
Correct.
organization. So it is I would say reallocating, repurposing, and more efficient way of dealing with things. And this is happening over a period of time in every era, whether it is in industrialization and what we're looking at AI today. So it keeps happening. But jobs have never gone up or gone down as from because of a technology impact. It gets repurposed, and there are new areas to conquer as such. I think with AI, you will have new areas to conquer because you're looking much more creatively outside to solve problems.
Yep,
Right.
I totally agree with him, and I'm on the same page. And I'll take the word out of his dictionary as well. Repurposing is the word, and that is where it will go. We have seen it multiple times whenever a technology evolution has happened. We have seen patterns, behaviors, working areas, plus ways of working, or the skill sets. They have changed. Ultimately, people have adapted to it, and that's how we will adapt. And with every change and adoption, we have moved further as a society as well. Like we humans as a race, we are moving ahead. So this is definitely a step change, and definitely it will have a lot of impact in terms of how we do things and how we perceive things, how we utilize a lot of technology, and also how we optimize our operations, etc. But definitely it will be for good. There'll be changes, and changes are inevitable. But it is all about I'll again focus on the word repurposing and then moving ahead.
Right. I think we've learned a very fresh word from Girish today, and that is really, made our minds rethink about how AI will actually work along with healthcare, not just replacing people or replacing solutions, but working along with them and putting across a new uh, point of view overall and a new perspective on how healthcare institutes can function. Thank you so much, Girish, for your you know very, very well thought examples, and the way it was presented was very easy to understand. Thank you for being a part of our panel today. Thank you, Arsh. Of course, we always have lovely time chatting with you, and it's going to be again a very, very great initiative for Gravitas AI to have uh, great speakers like you, Girish, on our panel now and then. So we'd love to have you again on our panel someday. Thank you so much.
Thank you.
Thank
Thank you. Thank you, Ash.
Thanks,
Thank you
Girish.
for having me today. Thank you so much.
Thanks. Have a good day, everyone.